We are delighted right now to welcome Kim Hudson to Charlotte today. Kim is the residential director at New Hope Treatment Centers, and she's been dedicated to helping people navigate mental health challenges. Kim, thanks so much for being here.
Thank you for having me.
You know, we have seen a rise in mental health challenges, especially among young people, adolescents, teenagers. Do you know why is that the case?
Well, I think the rise is due to sometimes it's for social media. For some of our residents, they've feeling pressure from social media or things that they feel that are pressures to them, and then it's just a stigma, like you said, in the communities where people are not seeking the help that they need for their minds. You need to help your mind as well as any other part of your body. So it's just a lack of knowledge, I believe, is the rise for the mental health struggles that we're having.
Well, help us help the parents too, because what should they be looking for when we see behavior and mood changes and mood different swings? What should parents be able to do?
So just be aware of what your youth normal routines are, but creating safe places for youth and making sure that you're encouraging dialogue for them to be able to talk to you and be able to understand that they won't feel isolated or alone if they're telling you about problems that they're having or issues that they're having. So just be available to listen and make sure that you're helping them to understand that it is okay to not feel okay.
How can a parent tell the difference between what is sort of normal adolescent moodiness and something more severe when you should reach out and get help? Because sometimes I think it can be hard to tell.
It's important, just like I say, to know the habits of your child. But when they start where they're having a difficulty socially engaging with peers of their own age, or when they're withdrawn from their family members or close friends, when you start seeing them want to isolate and be by themselves, and you can kind of know that it's something that's going on maybe internally with them.
Makes sense. Kim, can I ask you another question,
Yes.
though, about, we talked about the stigma a moment ago. What would you say to people watching right now, whether a parent who doesn't want to talk about their child dealing with this, or they themselves dealing with it, maybe they're embarrassed to tell people that they struggle? What would you say to those people?
So I would say that it's important for us to support each other in our mental health so that people won't feel isolated. It's important to build a culture of empathy and to build emotional resilience. So I would say to make sure that you're talking about it, and of course always seek professional help when needed, but just to make sure that you're reaching out, that you're talking about it, and that you are building a culture where you're around people who can support you. So having a good support system and using coping skills. So it's important to know what your coping skills are, to acknowledge that you're feeling a certain way, and to acknowledge your use your coping skills, healthy coping skills.
I was just going to say, can you talk about some healthy coping skills? We're not talking alcohol, we're not talking about things or over shopping.
Yeah. So I'm sure the counselors could go more into it, but healthy coping skills are just deep breathing, making sure that your movement, that you're having the healthiest diet for yourself, that you are maybe keeping a journal, that you're exercising, that you're talking to family and friends, that you're finding your spiritual connect with that you need to have. But those are things that help keep you grounded.
When you see the rise in these cases right here, are there enough professionals to go ahead and meet that need?
I'm not the expert on it, but I do think that it is not as many experts that is needed to meet the need, in that mental health area. But I think that as long as we continue to have the conversation, we are building a more acceptance to it, and that people will start reaching out more to get the help that they need.
I mentioned when we started the show that we've made a lot of progress, right, in that regard. But we do still have a lot of work still to do, correct?
Still to do.
And again, you think we combat that by doing things like this?
Absolutely, absolutely. The more knowledge that people have, they're less afraid of certain things. So sometimes people are afraid of things that they don't understand. Sometimes I'm a parent also that when we feel like, maybe we've done something wrong or it's our fault, we have to make sure that as adults that we are mentally healthy so that we can be there for our children and be a good resource for our children and other youth.
But I found one of the problems I had when I was going through this is that I was responding differently. I didn't have the coping skills that you talked about to go ahead and help my loved one to go navigate through this. And so I would fly off at the handle, and I had to go ahead and I was looking for someone to call to say, what do I do? This is stressful.
It is stressful. It is stressful, and that's why we have to make sure that we have, we're putting our best foot forward. At New Hope, we have a saying on LEAP where we say everyone deserves to feel their best, and hope happens here. So everyone everyone deserves to feel their best. So we have to make sure that we're feeling our best self, give our best version, so that we can be a best version for our children and for the youth that we're going to service or that you're going to come in contact with.
So when you're on the brink of like despair, is this the place that New Hope is, or is it? Do they take more people who are not in that category? What's the range? Is it from 1 to 10? Do you take people who are like maybe having a little bit of crisis, or people who are deep dead in crisis?
We lean into some of the toughest youth in the country. So we lean into, we're at 10. You know, we'll talk to anyone from 1 to 10, but we lean into that 10 because, like I said, we believe everyone deserves to feel their best, and we believe that we can help them in some way. You know, if New Hope is not the place they need to stay for a long time, then we're committed to making sure that they have access to the resources that they need.
Very good, Kim. Thank you so much. The website is there on the screen. You can learn more about New Hope Treatment Centers by visiting newhopetreatment.com, newhopetreatment.com. And a reminder to you, we told you this at the top of the show, we have counselors staffing our phone bank right now. The number to call, 704-329-3703. Again, 704-329-3703. This is confidential. This is totally safe. If you just want some more information, they can point you to the right resources here in our area, others that you can talk to, the right place for your child or the right place for yourself. Again, we want to end the stigma surrounding mental health and mental illness. I have said publicly, not on this program, not on WCNC, but in other places, that, you know, when I went through a divorce, you know this, Eugene, you were right there with me when it was happening.
Absolutely.
I have said I was a shadow of myself. I didn't think I could survive it. And if it weren't for the help of therapists and kind people and that community you talk about, finding people to care about you, my friends, I shudder to think about what might have happened to me.
Exactly.
And it was that bad. So I say that as just, you know, to offer some hope that a new day will dawn and you really can get through this.
Absolutely.
I believe that to be the truth. Thank you for what you do.
Thank you.
Thank you for being here, and thank you for sponsoring the show.
Thank you.
We appreciate it.